I wanted to record a brief response to the 2020 budget. In summary, the economics at a high level appear reasonable. Some assumptions are seriously flawed, and we have options now that would prevent the need for the massive debt which is being projected. First of all, the economics. We learned from the Great Depression in the 1930s that at a time like this, governments need to stimulate the economy. And that's what both the government and the opposition have recognised as being necessary. So that high-level setting is correct. Of course, there will be appropriate debate over details, as there should be. But this correct economic setting is not the case with the settings of our health response. And this inappropriate health response to COVID-19 is what is really threatening the budget. If you look at a couple of quotes here from the Sydney Morning Herald and PricewaterhouseCoopers talking about the budget. In particular, SMH says a crucial gamble that underpins the Morrison government's entire fiscal strategy is there being a vaccine available at the cost of $1.7 billion. But is this massive assumption realistic? If we look at the vaccine assumption, there's firstly no certainty that a safe vaccine will be available. There's no certainty that an effective vaccine will be available. And I mentioned in a previous talk recently that we're being dumbed down to accept something between about 30 and 50% effectiveness, which is inadequate. And there's certainly no certainty that the majority of Australians will want to be vaccinated unless the vaccine is proven to be safe and effective. But the serious question for me is, why will the government not look at existing treatment and prevention options that have been proven to work in other countries? That means we could secure Australia by Christmas. We wouldn't need state border closures, etc. Why commit $1.7 billion and massive debt into the future to a maybe strategy when there is available now a proven strategy at a fraction of the cost? If we look at some details, we released an options paper on the 25th of the 9th. You can see the link there. And please do look at it if you're interested in seeing details of these options. But I just downloaded a week ago the latest figures from Worldometers, which is basically the official international site for looking at data regarding COVID around the world. And I looked at the world average and 5 countries. And I highlighted Cuba because you can see deaths per million, which is probably the most accurate of the figures, more accurate than cases per million, etc. It's very low. And one reason for this, and possibly the main reason for this, is that the Cuban government allows doctors there to treat using the best methods for their patients, not just pharmaceuticals, but natural medicines, nutritional medicine, herbal medicines, homeopathics, traditional Chinese medicine, whatever the doctor thinks is best. And even more significantly, the Cuban government has immunized the bulk of the country against COVID-19, not using a risky, marginally effective, unproven vaccine. We'll talk about more of that in a moment. So in our options document, we listed many evidence-based integrative medicine treatments that doctors and other therapists are using now successfully around the world. If you add to that the proven options that Cuba is using, including their immunization option, it means that we have real options now to contain COVID-19. Australia already has the doctors and the therapists able to provide these options now. These options are simple, they have minimal risks, and they're inexpensive. And it's probably the latter, the fact that the pharmaceutical drug cartels can't make massive profits from these options, which means that the politicians in our country are not being advised that these options are available. But is this acceptable to you? Is the immense damage to our economy and our society acceptable to you when we have options? In summary, within our own borders, we can control COVID spot fires, i.e. localised outbreaks. The use of effective prevention options will lower the incidence. It won't remove them completely, but it'll lower the incidence of outbreaks. The use of effective treatments will mean there won't be a significant burden on hospitals and especially on the wonderful doctors and nurses working in our intensive care units. And we can achieve this without drastic lockdowns or excessive social distancing and mask wearing. Some restrictions may be needed locally from time to time, but our state borders could be open now. It just needs one thing to happen. It needs politicians to extend our medical response to COVID to use all proven options, not just those given the tick by the pharmaceutical industry. The social distancing that Australia desperately needs right now is distance between our health bureaucrats and the pharmaceutical drug cartels, and distance between our politicians and our health bureaucrats. We need intelligent, courageous politicians who can understand that they are being poorly advised and who will then act to make changes. If that happens, the budget will have a chance to rebalance in time and much more quickly than the present trend has projected.